Hello everyone. Today we will present on our project, Hand Hygiene Practices and Barriers in Schools During the COVID-19 Pandemic. Our group consists of me, Monica Castro, and Yoel, Naomi, Miranda, Madelyn, and Dr. Corbin. So first, to give a little background, the outbreak of the 2019 novel coronavirus has exacerbated the importance of health promotion and disease prevention through wash or water sanitation and hygiene. The World Health Organization and UNICEF have provided guidance on wash services and management, in which the importance of hand hygiene is highlighted. The term hand hygiene is used to refer to both washing hands with soap and water and using alcohol-based hand sanitizers. Hand hygiene is very important in combating COVID because, as declared by the World Health Organization, COVID-19 transmission can occur through respiratory droplets and/or contact. The virus can spread when hands come into contact with an infected person or surface and then touch the mouth, nose, or eyes. Due to its affordability and practicality, hand washing is an effective intervention that can help prevent and reduce the transmission of COVID-19. Especially in public settings, such as in school environments. School environments often have a high number of students, teachers, and staff in proximity. Thus, they have the potential to become a transmission hub for COVID-19. To improve the understanding of the connection between COVID-19 and WASH in schools, and ultimately preventing the spread of disease, this study will assesses the efficacy and barriers to proper hand hygiene practices in the school setting in the United States. Specific aims including determining the existing hygiene practices within schools resulting from the COVID-19 pandemic, addressing barriers and facilitators that exist within schools that prevent the spread of COVID-19, and gaining insight into teachers' attitudes and experiences related to current WASH practices. Now next, Madelyn will present on the methods.
For our study methods, we developed an online survey in the Qualtrics software. The target population for the study consisted of a convenient sample of K through 12th grade in-person teachers only. Although we did not exclude teachers from other states, our focus was on teachers in Florida and in Hillsborough County. The survey was distributed over social media platforms such as Instagram, Facebook groups, and Reddit threads. And the survey was also distributed by word of mouth through snowball sampling. The survey analysis was conducted in SPSS for quantitative analysis for a sample size of 166 participants. Open-ended responses were coded and analyzed separately in Microsoft Excel and were not included in the SPSS analysis. Analyses were completed for the US, Florida, and for Hillsborough County, and our results presented here today are the most significant findings from all three of those analyses. Now Naomi will present the results of this study.
After all responses were collected during our allotted collection period, our results were derived from a final sample of 166 responses, which removed any items reported from outside the United States. The overall demographics of our sample population identified as 91% female, of which 85.5% was white and 4.8% was Black, as the most highly represented racial groups. A vast majority of the sample, around 78.8%, reported teaching at a public school. We put a strong emphasis on collecting data from within Florida, so approximately 50% of the 166 responses are from teachers working within the state. We were able to discern findings about the three main areas of general hand washing behaviors of students and teachers, barriers to hand washing in schools, and changes in hygiene policies due to COVID-19 from the survey. Overall, 26.5% of participants reported their school's hand washing facilities need improvement. But the main barrier and reason why teachers were not able to wash their hands as often as they wanted was mainly due to a lack of time. 44% of all respondents also reported a lack of warm water at their schools, which is a necessary component of proper hygiene, especially concerning infectious diseases. Results showed teachers washed their hands and used hand sanitizer an average of 3 to 5 times a day, and an overall increase in the use of hand sanitizer as compared to before the pandemic. 47% of the respondents specifically noted that they washed their hands more often during the pandemic compared to before COVID-19. This may have some correlation to the enactment of school-wide hand hygiene policies upheld by the schools. You can see from the graph that most respondents indicated that a formal policy was put in place during the COVID-19 pandemic, but the majority also indicated there was no policy before. Meanwhile, though we were not able to survey students directly, teachers noted that students sometimes, or most of the time, washed their hands without being told, with responses leaning heavily on adequate to improved hand-washing behaviors among children. Finally, we performed a cross-tabulation chi-square analysis using the type of schools and teachers teaching in Florida as the independent variables. We have pulled two findings which support earlier statements or stood out to us as being relevant. 95% of private schools reported having access to warm water, but only around half of the respondents from public and charter schools reported having warm water in their schools. Also, respondents teaching outside of Florida were slightly more likely to have a hand hygiene policy than those who teach in Florida. Next, Miranda will talk about our discussion and conclusions.
This study helps school boards, teachers, and parents of children to understand the existing hand hygiene practices and barriers happening in other schools. Understanding the connection between COVID-19 and wash in schools helps to address barriers that may inhibit the health promotion and sanitation strategies that are necessary to slow the spread of the virus. Analysis of the survey found that access to warm water for hand washing in public schools needs to be improved. Hand hygiene policies should accommodate teachers and students so that lack of time is not a hand washing barrier. The COVID-19 pandemic has resulted in more schools implementing a hand hygiene policy. And hand sanitizer is the preferred method of hand hygiene due to its convenience. COVID-19 has posed a serious public health risk with implications of the public's hand hygiene behaviors. Hand hygiene education with repetitive practices in young children can help to improve school attendance and may improve child development and their well-being. Knowledge about the importance of hand washing helps to expand hand washing education, which could aid in disease mitigation, such as reducing the spread of the COVID-19 virus. Primary prevention strategies, such as hand washing and proper sanitation practices, are critical in keeping school environments healthy and safe. Next, Yoel will talk about the limitations and future works of this study.
Some limitations of our analysis include the fact that information on the schools that respondents taught at was not obtained. As a result, some schools may be overrepresented in our sample. Additionally, 32% of respondents were kindergarten teachers and 90% were female. These demographics are not representative of the K-12 teacher population. A larger sample size would have allowed for further analysis of our data, particularly the analysis of data collected from teachers in Hillsborough County, since that was an area of interest for us. And for future work, we recommend that the relationship between hand hygiene practices and COVID-19 prevention is further investigated. Furthermore, the long-term effects of skin conditions associated with excessive hand washing and hand sanitizer usage would benefit from further research as well. This concludes our presentation. Thank you for your attention.